Good morning. This is Jeff Herman with the Business Journal. We are locally owned and operated by the Youngstown Publishing Company. And today we welcome you to the second part of our discussion, Survive, Adapt, Transform. Basically, we're discussing operating solutions for today's environment. But I have to say, first want to thank First National Bank for sponsoring the program, Survive, Adapt, Transform. We have week 3 and week 4 ahead of us, and week 3 and 4 should be very interesting. We're going to dive into a lot of corporate finance details around loans, commercial, and literally now competing on a global scale. And so that will be a very interesting discussion that will take a turn here, and we'll release the details of that at the end of this week. But for today, our focus is on part 2 of the discussion. What if someone gets sick at your business? I mean, what can you literally do if someone gets sick at your business? If someone gets sick, one of your employees or customers on your premises, or say one of your employees or customers goes off premise, gets sick, and brings it back. Before we dive into that topic and that discussion around the liabilities, how to manage that risk, and how to manage your brand impact, because we've hesitated to brand this session when a viral a viral incident goes viral, because that's kind of playing on, that might be insensitive, because we're first and foremost concerned with health and well-being of everyone here in the population. But it's true. If you do have a viral outbreak at work, it could be very damaging to your business from a liability standpoint. You're taking on a lot of risks, and it really could impact your brand. So there's a lot to be seen there. So I will start, before we dive into the discussion, want to once again thank our panel members for joining us today. Really appreciate you joining us here at 7:30 on a Wednesday morning. First, I'd like to introduce Jeff Hedrick. Jeff, thank you for joining us today.
Good morning, Jeffrey.
Jeff's with the Prodigal Company, and he's a great partner of the Business Journal and the Youngstown Publishing Company. Nils Johnson with us, Johnson & Johnson Law Firm. Jeff, Nils also amazing collaborator with the Business Journal, great partner. Thanks for joining us today, Nils.
Morning.
And we have Brian Battaglia and Jim Klingensmith from L. Calvin Jones, also very great collaborative partners of the Business Journal. And we sincerely appreciate all of the guidance and even the opportunities you help us navigate through these challenging times from a risk management standpoint. So thank you guys for joining us today.
Thank you. Thank you.
All right, so we are streaming live. I want to thank everyone on the Zoom platform and also Facebook Live for joining us this morning. The topic of discussion today is what happens if someone gets sick at your company. What do you do? And we're going to start by handing this off to Nils Johnson. So Nils, what do you recommend if last week we talked about preparation, we talked about signaling and communications and really just laying the groundwork for a safe reopening. But it's likely that the pandemic continues, right? We're trending in the right direction. There are outbreaks in states like Texas and Arizona. I think Ohio is still, I check the data consistently, trending in the right direction. But it's probably going to happen to someone. So what happens if someone gets sick at your company? What to do?
Well, I got to step back into part of our discussion from last week, and that is, you have an obligation to 2 sets of people, your employees and then your customers, your clients. And you have to treat them each separately. So let's review that, take 30 seconds. If you have employees, you should have them all covered by workers' compensation. In Ohio, it's possible to self-insure. Some big companies do that, but certainly unless you're a Johnson & Johnson or General Motors or somebody like that, you want to be covered by workers' compensation, because if there's an injury, then it protects the worker who gets a payment for his injury, but it also protects the company. And right now, the law in Ohio is such that unless you are intentionally trying to hurt one of your employees, or unless injury is foreseeable and substantially certain to occur, that's the magic words, then you're going to be covered, and you cannot be sued individually over and above what the workers' compensation award would be, that's extremely important, where you have a highly infectious virus that to a certain percentage of the population, older folks in particular, it can be pretty lethal, and 6 or 8% for people in their 60s and older. Yeah. So that's how you deal with it vis-a-vis your employees and workers. Regarding the public, you have to have your business in shape such that if there is this claim, and you're exactly right, Jeff, just the mathematics of this, businesses are going to have sick workers. They're going to have people who come into their businesses and either are sick or conceivably get sick on the clients, on the businesses' premises. So you have to think back to before that happens, which is right now, and you have to take steps that align your business with the best practices of your particular industry. And you have to use, so you can, where can you figure out what those are? You can go to the Center for Disease Control. OSHA has this broken down very specifically by industry. You can get on the the Ohio Department of Health website. You can call in Mahoning County, the Mahoning County Health Department to help you think about it. And each business is different, right? We all have different facilities, different buildings, different ways our workers and our customers interact. And there's not one size fits all. You have to follow the general guidelines for your business, but also use common sense. Common sense is not out the window here. There's no magic bullet that if you do this specific thing, you're going to be covered, but you'll be okay. You've got to use common sense. I was working with a local institution yesterday, a nonprofit, and we're talking about how do we make a tour of the facility, and each point where there's hand contact, where there's elevators, where there's people entering the building, how do we set up temperature measurement, distribution of masks, how do we work on the traffic flow and so forth. So once there is a claim, one, you better be able to figure out which company you're going to call to do the disinfection. And of course, there are professional companies that handle that for you, but you need to line that up in advance. I think, Jeff, aren't you going to talk about social media, but you better have something thought out how you're going to respond in case something goes out on social media that alleges that you did this or something was wrong, so that you can say, wait a minute, I did these steps and I have documented them, so that you can kind of counteract that. So that's generally what you need to think about.
What we're saying is part of the risk management process is literally taking reasonable care, documenting, and what I hear you say is there's not a substantial penalty over and as long as reasonable care is taken, right? There aren't substantial penalties over and above workers' comp claims.
Vis-a-vis employees. Now, the general public, that is different. If somebody gets sick, they're going to have to come forward and show that you didn't take reasonable, well thought out steps to protect the public and your clients that are in line with what the government and the various agencies are recommending. If you can show you do those things, then you're going to be in pretty good shape. Not to say somebody can't bring a claim. That can always be the case. But you'll have something that is defensible.
Okay, so Jim and Brian, then from dealing with the public standpoint, so within employees, I'll say are within our sphere of influence or control effectively. When you are dealing with the public, how do you manage those risks or anticipate what you need to manage those risks?
Again, you're just going to follow the same guidelines that Neil's referenced, checking with the CDC or the health department or OSHA, follow the guidelines. And again, probably the important part of tying in with what Neil said is that the people that would want to claim that they got sick from your facilities, whether it's an employee or outside public. Outside public, that's where your liability comes in. They make the accusation, you're going to have defense in your general liability. And of course, they have to prove that it came from there. It's going to be very difficult, as we all know, to prove where it came from because people have lives. They don't just go from home to point A and back or point B and back. There's more movement, difficult to prove. On the side of the employer, with the employees, same thing. In the event that a employer would make an employee that they know is sick, but they don't probably know exactly what it is, but yeah, just to get in here. We need you to get in here and work. Now you're purposefully exposing, but outside of that, if an employee comes in, gets another employee sick, nobody knows where it's come from, but if you just got sick from work, it's a work comp claim.
What if there's fallout? So what if someone comes in, gets sick, and then, the offices, I've been into different office environments, and there's some nervous tension. People that you used to be able to like hug and high five, it's very distant. And what if your employees want to flee? I mean, what type of recourse do you have? Say literally people walk out and say, I'm not coming back. That's business interruption. I mean, what are our coverage, areas here that we potentially could lean into if that were to happen?
Yeah, so that's, as far as business interruption, it's interrupting your business, but it's not a business interruption claim per se. You have a physical loss to the property, and that's not going to occur because your employees don't want to show up. And that's something that I would think would be more in Nil's lap, because there's nothing there. The employees just don't want to show up because they're fearful. You're getting into a different situation there. Like at our office, we will start bringing employees back in basically because July is a split week in the beginning. So the second week of July, we'll bring them in on a split routine. 5 come in 2 days, another 5 come in a separate and opposite 2 days, and we just go back and forth, and they take turns like that and switch every week. And we've got everything there. We constantly get the office disinfected. We have the wipes. We have this hand sanitizer everywhere. We ask everybody to keep their hands clean every time they touch something, touch their face. You can only do so much.
I see. So what you're recommending from a risk management standpoint as far as operating your business, just do all the preparation, but there really is nothing exceptional you can do over and above your standard policies to protect yourself.
Can I add one thing here?
Sure, yeah, please.
I didn't touch on this initially, but there is this concept in law called assumption of the risk. So one of the things you can do is, for instance, when you go into the YMCA now, there's a list of 5 things that you're going in the door, you have to do your hand sanitizer. You are alleging and averring that you haven't been in contact with somebody who has a disease, that you don't have a temperature, you got to have your temperature measured and so forth. But then a business can take a further step of requiring a customer, for instance, to sign a waiver. And the waiver does 2 things. The person avers that he's not contagious, he hasn't been with COVID people. And then he's saying, I waive the risk, I'm taking this risk in doing business with this establishment. And I think those things are helpful.
Well, so and what's interesting is what I'm hearing is there are negative consequences of what happens if someone gets sick at your company. And I want to shift into to your brand impact. But Jeff, is this even a branding opportunity if you take the right steps, if you effectively publish the guidelines?
I think it's a necessity. I wouldn't call it necessarily an opportunity. I do think, though, that as I did a little research when you invited me on, I had perhaps some, the pandemic is a fluid situation, obviously, but I think I have some good news to share, and that is that just as the title of this seminar, Survive, Adapt, Transform, it's what people do, right? And humans are remarkably good at doing that. And I think we've seen in the marketplace is consumers have gone from understandably outright fear, going back 6, 7, 8 weeks into the beginning of this, right, to now more of a considered concern. And so what I mean by that is I've tried to look up what's happened to places where there have been viral outbreaks. And certainly there's been some short-term interruption of sales, but in terms of the brand being destroyed, we're not seeing evidence of that. And I think one reason why, and again, I'm not a scientist, but we see that contract tracing is showing us generally that by far the vast majority of cases, you're in the physical presence of someone who has COVID, and that's how you get it. So we're seeing that people, if there is an outbreak somewhere, people are not feeling weeks later they can't go back to that place, whether it's a big box store or a smaller facility. So again, no one wants short-term interruption of their sales. I don't, none of my clients do, but in terms of long-term brand impact, we're not seeing that. I represent, you know, fairly large regional nursing home chain, and they're very fortunate, but also the good work they do. They haven't had huge outbreaks, but obviously, as we've talked about the numbers, they've had some, but they're finding that people are understanding. They're understanding now that, as we've said, no one can outright prevent this, particularly at nursing homes, or hopefully moving forward, we'll have a better idea of what to do. But people are understanding, and they're not afraid now, you know, and certainly with the disinfection and so forth. But again, we understand more about this pandemic now and how people contract it and so forth. So again, you've got it, all the things these gentlemen are saying are true, but I think on the branding end, if certainly you take those first initial steps, you can show that. We'll talk maybe a little bit, certainly your employees have to believe you've done the right things, but from a public perception, you definitely can recover even if you have some people getting sick or an outbreak, if you take the right steps and so forth.
But Jeff, don't you need, if I could ask you a question?
Sure, absolutely.
You really need to communicate the steps you're doing, not as far as branding so much, but as maintaining whatever brand you may already have.
Yeah.
Make the people feel safe.
You're right, Niels, and I didn't want to underplay that. I want to say it's a given now. You better be doing that, right? It's a table stakes. It's a part of doing business. If you're not doing that, there's something deeply wrong. But at the same time, that's expected. I don't think anymore it's like a branding opportunity to say, oh, we're different from everyone else. We're doing it better necessarily. I mean, you know, that's a good thing, certainly, to do that. But yeah, really, it's a given now. You better be doing those things just to compete.
And I think it makes it less likely you're going to be sued if the person, they don't, or they got it. And if they have in their mind that you seem to really try, it's less likely you're going to have a claim filed.
And I would say the first thing I would do if a new client called me and said, hey, this is what happened, I'm going to say, okay, let's get your lawyer or someone like Nils on the line, because it's clearly both a legal issue and eventually an insurance issue, as well as a branding marketing issue.
How aggressive should the communications be? You know, I hear there's a lot of sign this flyer when you enter a physical presence, but are we talking a multi-platform campaign, if you will, which, you know, getting into social media as far as viral outbreaks, it's likely that someone could say, I was at location X and I got sick, don't go. That's just user-generated content you can't control.
Right.
What do you do in that situation? How do you get ahead of that?
Yeah, well, hopefully you already have, as we've said, you already have, you know, social media platform. You're already, whether you're using the HubSpots, the Hootsuite, you have, and somebody, whether internally or externally, who's ready to move, right? And so you've talked through what, you know, those kinds of things. But even I want to get to your own efforts. Again, you need to inform everybody. But I've definitely had one client that early on was maybe almost too aggressive, creating fear about coming in, right? And so you want to find that line. Hey, you better inform, but don't make it the only thing you're communicating, because you're maybe creating more concern than your competitors are. But yeah, you want to make sure, you know, and I think today clients are better understanding that you don't want to be reactive. You want to be proactive, have your social media team, have your policy. And so we try to do with our clients. So if anything like this happens, you know, we're ready to go at a moment's notice and do it. But at the same time, you know, there's that line, just like we all have human beings, friends or people we know, that people who are never transparent, never share with us, we don't trust them, do we? But there's also so much as like TMI, too much information, oversharing, right? And so we want to also watch that. We do need to share with the public, but we don't need to give them, you know, all unnecessary details and overemphasize, because again, we look at the numbers. What is it in the States now? 2 million people affected. The public understands now you may have not done anything wrong. You may have great, you know, cleaning policies and social distancing. If something happens, it doesn't mean your business is, you know, jinxed moving forward.
Right. So a question I have, and I'm going to address this to Brian and Jim, and then Jeff, I'll actually address the same question to you. Brian, Jim, you work with businesses across the board. You're in and out of a lot of companies. You have a lot of calls every single day, businesses across the board in this region. Have you seen any companies you feel are really taking the right steps and are going over and above, like really just hitting the right tone here?
Personally, I feel like everybody that I've visited is doing the right thing. Like Jeff said, you don't want to scare people. The goal, I think, is to make everyone feel comfortable and welcomed. So, you know, follow the local guidelines. But at the end of the day, me personally, it just seems like people are happy to be able to get back into some type of routine, some sort of normalcy again. And, you know, it's just what Niels mentioned, use some common sense, And again, overall, I think everybody's been very positive. Right now, I think would be a great time to brag. Social media right now should be your avenue to go to and say, hey, look, here's what we're doing. Come see us. And again, I see lots of positive things happening. It's a time to support the local community. I've got friends and clients who own restaurants. I have friends who work in restaurants. And, my time being in and out, those places are starting to fill up again. And, they're following the guidelines, the social distancing rules. But what I'm hearing most importantly is that it's just amazing how much support and how generous people are being during these times. From a compensation standpoint, I've talked to numerous servers in the restaurant saying they're just blown away at how generous people are being right now with tips and et cetera. So again, I think it goes back to, we live in a great community where everybody wants to support one another. People are doing the right thing, taking the right steps, and it's good to be back.
So it doesn't seem like an overly litigious environment right now. There's a degree of positivity, and there's no one looking for the gotcha.
I haven't run across that. I mean, I think overall, I'm getting a lot of positive feedback. I know there are people out there that are more concerned than others, and everybody has the right to feel how they want and take whatever safety precautions they want. But overall, everything I hear is positive.
Nils, wouldn't you say that, again, it goes back to what you said earlier with the inherent risk when anybody goes out into public, especially where you're going where there's even more people. A business can do what they can do to protect, but you're still taking in some inherent risk because you know what's out there and you still want to go out.
I think that's true. There's an interesting thing that's happening here, and so you have this intergenerational tension because young people are going to live forever, right? Weren't you like that when you were? Well, you are young, Jeff. What am I saying? But as you get into your mature years, you become more cautious, appreciate life more. But young people don't take the precautions, are not as cautious. This is expressed in the infection rates right now, where you see the average age coming down, probably because older people are being careful and younger people aren't being as careful. So in the operation of your business, you're going to have this generational tension, but you've got to insist that the younger folks protect the older folks. And even though, they'll not want to wear their masks or just not social distance as readily as other people, you need to enforce the rules so that they do. And just because we've paid the price of being shut up doesn't mean that this thing has gone away. So in your policies at your business or your store regarding both your employees and the public, you have to keep the pedal to the metal. You can't let people relax, or some bad things can happen.
Right. Well, and actually, what if you have a tightly knit organization and someone does get sick? What disclosures are important? Do you have to disclose?
I would. I absolutely would. And I would make it very easy for somebody who thinks they may be sick to stay home with pay, because you don't want to incentivize somebody to stay on the job and hide their symptoms, just because they got to have a paycheck. So, if somebody is at your place of business, you don't have to broadcast it to the world, but you better get in there and sanitize and have a pro conduct that operation, and let people know, so that if immediate people who have been in immediate contact may need to quarantine. I mean, the rules haven't changed just because it's warm and everybody's outside now. You have to be cautious.
Right. So there's two different scenarios. So Jeff, from a retail standpoint where the public is coming in versus a B2B standpoint where it's a closed facility, I mean, what would you recommend from a disclosure standpoint handling those two camps?
No, you're referring to Nils just explained. If it comes to employees, I think absolute disclosure, right? Now, I think you're asking about the public. Is that correct? Right. Well, again, the first thing I would do is I looked at Nils and I would say, because I've been trying to find out whether or not you have a legal obligation to inform the public. And I'm not sure that you do. Nils, can you tell me legally, do you have to inform the public? If you have had let's say I've got a retail client, which of course I do, and an employee gets sick, maybe, it's one thing if they're a warehouse worker, but if they're a, cashier or whatever, do you have a legal responsibility? I don't think so. Am I correct?
Alas, like many things in law, it's unclear. Nobody has written rules in this area. We're all working our way through it, and these things are being developed, and the law will develop, but the law is going to develop out of lawsuits, common law. Most of our law flows from the experience of actual litigation, so we don't know the answers to some of these things yet.
Yeah. So in that case, Jeff, that's, being very practical, I'm probably not going to tell my client, well, I think you need to disclose it. But I think the real issue is, do you have the PPE? Are you taking all the steps? Have you then, after that happened, done the disinfection so that you can, not only from a matter of law, but of good conscience, saying, well, this did happen. The person's not at work. We're paying them, as we mentioned. We've disinfected. We've looked to see are any other employees sick. All those other steps are taken. I think that's the moral obligation.
If somebody came into my law office and met with a specific lawyer, and it turned out that the lawyer subsequently was sick, I absolutely would feel I have an obligation to call the specific client who was in. Okay.
That could be more difficult in a retail situation where they might have seen 400 people over a number of days. But if you had the PPE in the place and you had social distancing, I think that's how you look at it. But again, obviously, individual situation could vary. But you want to consider, talk to a lawyer, and then as well as your communications consultant.
One other thing I'll just add real quickly is that there is political motivation out there to have liability protections in force. That's being discussed in the U.S. Congress, probably will come up in the U.S. legislature to try to give businesses protection against these claims. I don't agree with that. I think that takes away some of the pressure on a business to do the right things. But that is out there, and that may come into effect. I don't know.
Right.
So we're really, you said, from a common law standpoint, it's really about the precedent that's set. And right now, there is no precedent for the levels of disclosure. So Jeff, for example, a retailer that sees hundreds of people coming in and out of their doors every single day, the media. So the Business Journal reported a pharmaceutical retail outlet had an outbreak, and that took off, caught fire, and the people weren't happy about that. The media got a hold of it, and it's our duty to be transparent and report the facts. I know Lane Transport, they managed through that. How did they manage through that process?
Well, I think, one, I just want to remark, we're talking about precedents, and all I can think about, I can't wait to the day when half the commercials don't start with, in these unprecedented times, right? We've just heard that phrase so much, haven't we all? Tired of it. But yeah, so Lane Life Transport is one of our clients, and obviously their job is to get sick people to the right facility. And initially, again, as little was known about this, it was very difficult on them, and some other people are at risk. They did have just a couple of people get sick, but then as this was understood, and as they took additional protections, really, and they only had one person actually get sick, by the way. They had a number of people exposed, had to go to quarantine. But then, quickly, and Joe Lane is a guy who really started the paramedic training here in Ohio, knows what he's doing. So, and when we've tried to come out and be here's the steps we're taking, here's what we do. We've come out, we did a lot of radio spots and print media and so forth, talking about Joe thanking the frontline workers. Really, I think it comes back to public understanding, hey, you're putting your lives at risk for us. And so, we're accepting of the fact that it's remarkable they only had one actual person get sick out of a staff of 130 people, right? So we haven't had any real big issues. And again, Joe's taken extraordinary steps, kind of been ahead of the curve in protecting his people and getting sick people to where they needed to be.
Right. Well, that's good. Well, that's a great place to end this episode. So I'll ask for closing comments now because it is just past 8 a.m. on Wednesday morning. So just to round this topic out, as far as the disclosures are important, transparency is important, messaging is important. What parting thoughts do you have? Brian, I'll start with you and go to Jim, Nils, and then Jeff to wrap this up. So Brian, any parting thoughts?
really what I've been saying for a while now. Just continue to do the right thing, continue to support the local community, lift one another up. This is the time for us to come together and shine, be smart, use some common sense, and just enjoy being able to be back out and about.
Yeah, great advice, Brian. Jim, how about yourself?
I'd say the same thing. Just keep positive, keep plugging away. Do what you have to do to maintain safety. I agree with Nils as far as anybody trying to make a law where they just make businesses safe from any lawsuits, because that would make everybody put their guard down. I think you have to have reasonable care. Outside of that, people, keep your hands away from your face, keep your hands clean, stay positive, and we'll get through this. And that's what Brian and I both see quite a bit, a lot of positivity, and like he said, a lot of people anxious to get out and about and start interacting.
Excellent. Nils?
Same thing. Use the best practices in your business. Find out what they are for your particular industry and align yourself with those best practices. Let the public know, let your clients know, let your workers know. Make sure you have workers' compensation coverage, and above all, use common sense.
Right. And Jeff, and that's where I keep going back to this. If it's not deliberate, it's just the fact that there is a strong communications plan here. As a function of that, this is I hate to say it, it's a good branding opportunity.
Yeah,
right?
well, yeah, I think just, we're all waiting for the vaccine to come out to really inoculate ourselves against the actual pandemic, right? But for a business, the best inoculation you have is having a strong brand going in any crisis in the first place, right? So you can't predict what's going to happen. You can't totally control certain crises, but if you have a strong brand going in, if people already trust you and believe in you, my client Sheely's, Furniture and Appliance, obviously that's just a powerful, strong brand. It's got 67 years of trust. And so they haven't had any issues, by the way. But if they did, then I think people are going to be more understanding to go. So, obviously I'm a bias, but start building your brand now. Have people believe in you, as well as all this, the practices we're talking about. Have people know what you stand for, what you represent, and be out there in the marketplace. And then if something unfortunate does happen, you're going to recover from it that much more quickly. It's like an athlete. We all know that if you're already in good shape and condition, you get an injury, those people recover much quickly. Much more quickly. The same is true for a business that takes an injury, so to speak.
Right. That's a great point. That's a great analogy. A strong brand, strong documentation, strong best practices and policies in place, clearly documented, best intentions, and in the unfortunate incident, if something bad does happen, it's one bad data point amongst a wide, deep array of positive things in which you've done to take reasonable care to just make sure we can get back to operating safely.
It's not a knockout punch anymore. It's a body shot you want to take, but you can recover from it.
Right. Yeah. You just take that hit, but keep going. So, Well, this has been great. I certainly appreciate. We've run a few minutes over. You guys have been very generous with your time. We actually do have questions that have come in, and specifically the question is, we'll provide a sample of a waiver for guest clients, customers to sign as they come into your office that you can share. So if anyone has a sample waiver that they've seen, or Nils, if you have a recommendation on the terms that one would use in a waiver, I'm
drafting them right now for several of the local institutions. I'll send you one, Jeff, and you can send it to the questioner.
Okay, that's wonderful. That's great. So I do appreciate it. I want to thank everyone for joining us this morning. I want to thank Jeff Hedrick, Nils Johnson, Brian Battaglia, and Jim Klingon-Smith for joining us today. Your insights are truly valuable and helpful as we survive, adapt, transform, and get back to operating in a safe way. And I'm looking forward to where we're using this as a transformational moment, a transformational opportunity. So we definitely are out of this survival mode, hopefully for the most part, into it. We're adapting and we're moving on to transformation, which we'll set up next week. As far as investments in corporate finance and wealth management, the next 2 weeks, we're really going to shift gears into how do we, double down and power through this, and how do we put the right financial programs in place to accelerate and power through and drive ultimate transformation. And I want to thank once again First National Bank for the sponsorship of this program. And thank everyone joining us today on Zoom and Facebook Live. And I want to thank our esteemed panel, Jeff, Nils, Brian, and Jim. It's really generous with your time. Thank you so much. And we'll talk to you again next week.